Hi, my name is Dianne, and if you are dreaming to work in Norway as a helsefagarbeider, let me guide you step by step because I'm currently working here, and everything that I will share to you is based on my own experiences and not by theory. This video will help you exactly understand what you need to do, what to expect, and how to get started. So basically, with the helsefagarbeider, I think it translates in Canada as licensed practical nurse. Some call it under nurse or just a healthcare worker. With the helsefagarbeider, which has a big shortage of healthcare workers in Norway still today and increasing so, is one of the easiest and fastest ways to enter the system. And what the employers usually look for is that it's a big plus if you have BS nursing or you're a licensed nurse in your country. But basically, they want you to have that healthcare background, associate degree, nursing degree, caregiving, or healthcare diploma from your country. English communication, B1 is enough in many places to get by. Willingness to learn the basic Norwegian, A1 to A2 at the minimum, but of course, since if you're planning to live here for long term, I still suggest to keep studying or even start studying now. The way I do it is I go to Norwegian websites and learn on my own. There are YouTube free videos you can go to. I love learning online because I have more time to copy paste it or go to the dictionary and know what it means. So yep, that's another thing. Clean police clearance, but this is when you are on board of getting hired. They will send you the details or the requirements that you need to send them before you get started. Updated CV Scandinavian format, which I could also help you with. Vaccination records like MMR, hepatitis B, TB, these are later on. Bonus qualifications, which gives you an advantage to get hired faster or get a higher pay, are in my case, I hold a degree in the license from Philippines. So if you are in that same scenario, I could definitely help you negotiate later on if you want to do the mentoring sessions. Experience working in UAE, UK, Ireland, Canada, Sweden, Denmark, if you wish so, to come here and work. Experiences in elderly care, dementia, home care. In elderly homes, we have here what we call long-term and short-term care, where short-term care usually are patients who come from the hospital and needs help before going back, stabilization, making sure everything is well for them before they go back to their homes. Driver's license is a big bonus if you're going to work in home care, by the way. In Norway, they have different systems, I noticed, compared in Sweden, but we can get into that later on. So the bottom line here is even if you're not licensed nurse in Norway, your foreign nursing experience will be highly valued, and it helps with salary negotiations. So with that being said, you also need to have an authorization. It's very, very, very important. Like myself, even though I'm a nurse from Philippines, they have evaluated my education here in Sweden so that I am done with my nursing degree. I am only needed to go for the exam, and if I pass that, I am licensed in Sweden, and then that licensure or that paper that says I can practice as a nurse, I can just send it to helsedirektoratet in Norway, and they will evaluate that, and then automatically it will be godkänt. What's that in English? It will be valued as I can practice as a nurse there as well. And the same in Finland, Denmark, provided that you know the language, of course. So steps to get the authorization, you go to helsedirektoratet .no. I'll put the link below. Create an account, upload the documents. In my case, before I left Philippines, I made sure I have all my documents set. One is it makes it easier. You don't have to ask your family if you're already in Norway and then you don't have those documents with you. You have to sort of back and forth asking them to have it, what do you call that? You know, get the stamp, make it validated, certified with the lawyer or notary in a notary public. That's what we have in Philippines. And that's what I did. Like my transcript of records, my diploma, certificate of employment. What else did I have? Good moral character, my transcript of records from high school. I'm born 90, so we still have that high school educational system. And yeah, my passport, my license, and I paid, I think, 1,800 Norwegian crowns at that point. And then you have to wait 2 to 16 weeks depending on which country you're coming from. All this can be found on helsedirektoratet. If you need some help, you can also reach out to me. So if you're, example, a nurse from Philippines, you're very likely to get a helsefagarbeider autorisasjon, not a sykepleier, not a nurse yet. And then you can upgrade later after passing that Norwegian test. There's no test in Norway to be a nurse, but rather, I mean, there's no test for being a helsefagarbeider if you are already a nurse from Philippines, for example. But in my case, in my experience, I've been working with, I have worked with Spanish nurses, and like in their BS nursing program, they study it for 3 years. Same in Sweden, same in Norway. I think it's also the same in Denmark, Finland, and other European countries. And I asked this Spanish coworker, do you have to undergo a board exam or licensure exam? No, they didn't have to. So it's different in Philippines in that sense. And also we study for 4 years. Yeah, and especially if you have an experience, they will still include that they will still evaluate that when you send your papers to the healthcare authority who value or who evaluates your nursing background or healthcare background. And I suggest to apply for autorisasjon even before you start your job hunting, because it just speeds up everything. Because one is very, very important that you have the authorization. And I suggest to study the language now and get improve yourself over time. Of course, what's needed when you apply: CV format in Scandinavian style. They want it. The Norwegians love it clean, simple, easy to read CVs. No colors, no fancy designs, no long paragraphs. In bullet points are good. Clean headings, 1 to 2 pages. Reverse chronological order. you want to bullet point those key responsibilities that you have done, your skills as well. And it's very important if you are somebody who is already here in Scandinavia and wanted to move to Norway and work for bemanning or agency, kommune or municipalities. You want to indicate the systems, the documentation systems that you have used, like profil, gerika, helseplattformen, notus, etc. So for example, bullet points would be like provided daily care for elderly patients with dementia and mobility challenges, documentation using profil or helseplattformen system, care for palliative patients, supported full risk patients. I mean, especially in elderly homes, it's very usual that they have risk for full. Required sections are very easy: your work experience, education, skills, certifications, references. It could be on request, but I suggest you want to do it, you want to prepare it ahead of time, because it just speeds up the process. You don't have to go back and forth. You know, sometimes it takes time to ask for your previous boss or previous colleague if you're not really that friendly. So I suggest already when you are working, collect those and just let them know that, hey, I got your contact already. I'm planning to work in Norway. I would really like you to be my reference. Is that all right? And of course, when you ask them with their contacts, you want to let them know by that time you got those. And then it's just a reminder when you're applying. Get this ready. It's very important. And normally references, they would want to have at least 2, sometimes 1, a leader or your boss, and then 1 or 2 colleagues. So I would say 1 boss or 1 colleague, but prepare 2 bosses from different work experiences, or 1 boss or 1 leader if you haven't worked in many places yet, and then 2 colleagues in case they couldn't reach them out right away, so they have options, because it happened to me as well. No need to put your birthday. It's unnecessary, as well as your religion. It's unnecessary. That's just the truth of it. Yeah, it's basically everything that is related to you getting hired as a healthcare worker. Now, this is one of the biggest questions I get, so let me explain it simply. Explain the differences between agencies versus kommune or municipality. Bemanning is basically staffing agencies. Very important that I'm going to be using a lot on my video. Kommune, also municipality in English. We can talk about the bemanning first, the staffing agencies. If you are able to find the well-established agencies, they could pay you higher on an hourly basis. And this should be standard, because bemanning helps you to have housing and it's free. In my cases, I have worked in 3 agencies right now, and I didn't pay any dime from that free housing. Travel is covered when I get to my assignment and after I finish my assignment, or we call it uppdrag. This is reimbursed provided that you finish the contract. Okay, this is very important. So whether you take the some required travels that you have to take the bus, take the flight, and take the train, those will be reimbursed, no problem. And collective traffic or public transportation is very easy here. Basically, they will even help you which app do you need depending on the region, the assignments you will get from. This is the nice thing with staffing agency. They help you all throughout. You can contact them at any time. They're very approachable and easy to talk to, which in my experience, I have great experiences with my agencies. Flexibility with the shifts that you want. You basically tell them what work do you want, and they will find you the work that fits you and your wish of region that you want to work in. But I must say that flexibility of being open to whichever places will be available for work is better to put you, especially if you are a beginner going on staffing agency. And that way you can try different places. I had been to the south of Norway, north of Norway, in the middle of Norway, big towns and small towns. They're all great, even though you're on a small town. Staffing agency will still put you on a location for your lodging that is nearest to your work, because that's their job to find that. It's also make it easier for you working long shifts or working every day or so forth, so you can go back home and rest. So the cons of agencies are there are no guaranteed hours. But I think this one is you actually have guaranteed hours, provided that they have found your assignment. It could be in the kommune, municipality. It could be in the hospital. It could be in the rehabilitation center. It could be legevakt, that's for the doctors. This is mostly for nurses. What I'm talking about is licensed practical nurse, helsefagarbeider, or under nurse. Yeah, with working in staffing agencies, you will have your schedule sets, of course, and you tell them what shifts or what working shifts are you wishing to work for. Do you just want night shifts? They will look that for you. Do you want both? Are you flexible with both day, afternoon, day or evening and night? That's fine. Do you want to work in weekends? But I highly suggest, if you are starting, you want to be flexible as much as possible, because that's the key to getting an assignment. So that's why this really fits, especially for those who are single or who have a flexible partner with them. I already have children, and flexibility is a little bit off my case, because I miss my family whenever I have to leave them, especially my son is only 2 years old. So I personally work in kommune, municipality, also through bemanning if I want to. It's still there. I'm already signed up. I have a profile. I can basically just call them, and I get those automatic emails regarding assignments information, and I could just basically, hey, I want this job, can you put me on board? Yeah, so I see the benefits of both. Right now in the municipality, I am working as vikar. It means a temporary worker, on-call worker. But even though I'm on call, this is a small municipality, I get overtimes. They really need people, especially in small towns, because Some people want to live in big cities. I'm okay with that, but I'd rather live in a small municipality. It's more quieter. I mean, if you love city, there are also big opportunities for you. So there's no problem getting work in Norway. For as long as you have the autorisasjon, you're Norwegian. I'm actually planning to make healthcare words and maybe even videos in the future, like a setting of care combined with the language. Let me know about that idea if that would help you guys. So if you're new to Norway, bemanning can also help you fast. Like I said, I have worked with a lot. There's actually a lot of Spanish nurses that I have worked with when I was in bemanning, and also from Finland, from Denmark, from Sweden. Hi. And those who have worked in the same big company of agency that I'm working with, and they have worked in other countries as well, like even from France. I have coworker like that. So yeah, bemanning can help you enter fast, especially when you have experiences, whether if it's an international experience, because it gives you that sense of flexibility, and they see the bemanning will picture you as you have that sense of flexibility to go on to a new challenge with ease, because say for example international experience, and then you're going to Norway with a different language, a different kind of system set up, and going around your adaptability. That's what I also want to point out, adaptability. So that kind of attitude, just be nice, and then you don't be afraid to ask questions. This is a nice thing with the culture here. There's equality. We don't see our bosses. We don't even call our bosses like sir or ma'am. We call them by name. But of course, there's a respect,